Okay, could I ask our last panelist to come up? So Wolfgang, Khalil, Andrzej. Khalil's not here, okay. Okay, Salah-Dine. Okay. Oops. Sorry. Yes. Yeah, no, I just thought I was going to be trapped in the... And Pierre, do you want to come and join us? Do you want to come and join us? Or are you going to come later? Okay. So let's introduce everybody. Pierre, we've already met. Wolfgang Burtscher, who's Deputy Director-General of DG Research and Innovation of the Commission. And you're Andrzej Rys. Have I pronounced that name right? That's correct, yeah. Oh, okay. Who's the Director responsible for health systems in DG Health and Food Safety, and Salah-Dine Chibout, you've again already met. Wolfgang, let's start from you. What do you take from the discussions so far today?
Thank you very much, Vivienne, and good afternoon, dear colleagues. I only participate in the afternoon, and I felt it was a very interesting and thoughtful discussion and consideration here in the panel. What do I take away? Let me explain to you what I take away as somebody who is looking at the public funding for research and innovation and IMI. And let's quickly recall, why do we fund IMI, in fact? It was to ensure the competitiveness of the European industry, in particular the pharma industry at the beginning, but also to address bottlenecks still in research. So that was the reason why we have brought together public authorities and private partners. I understood that this was a very successful endeavor. I think what our commissioner has concluded at the occasion of the 10th anniversary, this radical collaboration which was imposed on the academia on the one side and the private business on the other side, was very successful. Now, what I take from the discussion is that there are still issues to be addressed. There are still bottlenecks, new bottlenecks, old bottlenecks. The elements I have taken away is that there is still substantive research bottlenecks, which we have to identify through excellent research. Linked to this, the whole discussion about data, research in health becoming an issue of availability of pertinent data. Another issue which is not related so much to the substance of our research, what is the search about, but the other big topic I identified is about how to deploy health research to ensure that it is deployed and patients can profit from these new technologies. And I think there IMI has already played a big role in bringing together academia and industrial partners. It has been extended already to other partners through the, how do we call it in IMI, the associated partners. But I understood from many of the contributions this afternoon, there is still a gap regarding the rapidity of deployment and the fragmentation of deployment. I think Luc has mentioned the issue of fragmentation. And there the question arises, how can we build governance in IMI that even these bottlenecks in terms of governance, in terms of rapidity, and in terms of fragmentation in deployment in national health systems can be addressed. I think this is what I take away from this morning's discussion.
And actually, some of the deployment is not necessarily about money. People always assume that actually adoption and diffusion is about money, but I think that frequently it isn't about that. It's about structures and cultures and behaviors.
Exactly. I think what Luc has very well explained is that the uptake of the research results, the technologies which we have developed, at the end is left to national authorities who decide whether these technologies are used in the national health systems, whether they are reimbursable. And I think here the question arises in the framework which we are creating, or in the ecosystem which we are creating to cover the whole innovation cycle, is this last part not missing? And I think Andrzej, who is working in DG Health, has quite some experience in this respect.
Well, let's then pass the baton to you on that.
Thank you, Vivian.
Because it's the last mile, essentially, isn't it? So that so there's a question not only of telling everybody about this, because I think what I've heard quite consistently today, that perhaps we're not as good as we ought to be at IMI about telling everybody about what's been achieved, but also this bit about the last mile, the actually getting it deployed.
Yeah, about also my observations. I would start from something which I was thinking what I missed today, because maybe also it's good to ask. I miss clinician in this room, I don't know if you realize that there was no one clinician during the whole debate today morning, today afternoon. And my kind of worry is that, positive worry, is that we are coming to a little bit to the crash between the two civilizations or culture, as you most probably would like to say. On one hand, we have the culture of practicing medicines of today, and we're coming to the culture of the future, which involvement of patients, involvement of other professionals. We hear about the importance of the pharmacists, but I can tell you, in the current culture, we are still far away. The doctors still have questions. What the nurse can do, what physiotherapists can do, what psychotherapists can do. I have seen many times with psychiatrists, they don't respect psychologists, or nurses not kind of seen as a part of the team with the important tasks. Like for example, responsible for the quality of data, if clinical data. Or we miss some professions like data managers. We're speaking about data, but when I ask question one day, who is going to process data? It's not only computer, because computer has to be supported when data coming in, the data living and analyzed and presented to the clinicians. But I think the critical question is about relations, and the way clinician should be involved in deployment of all these, beautiful or good ideas we are discussing today. So this is my kind of a little bit missing point of today's discussion.
And I think that we did actually discuss earlier today how important it was actually to involve a wide range of actors right at the beginning of projects, so that you had their buy-in from the beginning. Because one of the interesting things, I guess, is that everybody is interested in new technologies, but they're also interested in seeing it, tweaking it to their own way. So the thing that you often hear is, it'll never work in Liège.
Yeah.
That's a...
but I also a medical doctor by training, and a number of years with not practicing. But I still remember, when I did my medicine course and started my practice, it was Liège, Brussels, but even the street in one city is hospital, the street A is treating different than hospital street B or doctor X or Y. So this is one of more culture change. But I think all this data, learning from data, guidelines, thinking about standardization of data, all these things might happen in the organizations which we believe will be in the future. So this is really interesting point, and this is why, for example, we started discussion with. The leading is the Erasmus Medical Centers. We are planning, this is something for April next year, invite the deans of medical schools from each country just to start discuss, we call this in bracket digital doctor. It's more about the future, how you engage, the new generation of doctors, older generation of teachers, how you bring, new ideas into the medical practice, and how you start, teaching really younger generation, but of course, not forgetting the older generation is today in charge, but also in practice. So this is one area. The second area, which I think is what already was mentioned by Wolfgang, who is deploying in the member states? What's the responsibility? Experience so far from number of studies we did and discussion we had is the most successful so far the regions. The regions, like Catalonia, Basque Country, I don't know, mentioned few others in Italy or in Germany, and there are regions or even local communities. They decided, let's make change happen. So they're able to convince doctors, they're able to convince the whole environment around the patients to make things happen. So I think this is the also question: what is the level of the change? On the scale we can manage this whole change. And this was famous study by McKinsey a number of years ago when they said digital deployment only happened in the population smaller than 10 million. I don't know how they came to this conclusion, but it really, when you see big countries, including country best, the big deployment was very difficult to happen. There are many failures, and of course this is the last point I'd like to make, because we have so many failures in the system. So many governments are still a little bit, in difficult position to say, okay, let's go. It will change the world. It will change patients' life. It will change the outcome. Even everybody believes now it makes sense. We see digitalization is changing many sectors, but to get into the big game with the public money, with the public responsibility, it's a challenging factor, I think, now in the
and
current.
How much do you think that revolution can be led by patients? Because we very often talk about technology push, but actually there's a technology pull which comes from citizens. Because citizens, if you make an appointment with your hairdresser, I mean, probably not you make an appointment with your hairdresser, but make an appointment with your hairdresser, you get a text and all of that, and it's all digital, whereas we can't get into health systems. I mean, that's slightly going off the point, but I guess one of the things that you need to be able to offer advance to people, but you need them to be able to tweak it in their own regional way, because otherwise you get that not invented here syndrome.
No, I am kidding that I am patient since a few months, and I have my observation as a patient, and I fully agree that we as a patient, now speaking as a patient, we are knowledgeable, we have access to many informations, we can help with the data collection and so on, but I think the problem is, again, in the way even people like me who have relatively easy access to doctors and hospitals understand the topic, we still see the barrier of the system, and providing data doesn't mean that you get answer to your goodwill, and learn about the outcome of the treatment or right collection of data you should make. But the very last point on this, I mean, there's also very critical factor, change factor. In many countries, physicians, we have a problem. I can speak now as a physician, chapeau. We have a problem to accept the concept of the healthcare provider versus, patients as a client. This language is somewhere there, but it's very difficult to accept, from the culture we were born. We got our ethical programs, and all these things also needs, a lot of work and understanding, but I don't think it will change overnight.
Salah-Dine, what have you taken from today?
So I still have some voice left. I hope you can hear me. So many things. First of all, this is not my first stakeholder forum, Pierre. We have done many, and the acceptance of IMI as a change tool is there. We can say after 10 years now, there's no much dispute about IMI or not IMI. It's there. So it's really a competitive advantage for Europe. I think it's important to say that. Now, what I was hearing today, I'm hearing from the audience and from myself as well, we need to be more ambitious, probably. So we could do more. We should do more. there are, of course, a lot of areas that we need to cover. And we always understood that we have to do it together. I'm representing the industry today, and we know, we understand, and Luc was mentioning the Alzheimer earlier, we have not progressed that much with Alzheimer. We have injected hundreds and hundreds of millions of euros in vain. So we still have some hope that we can do something, but we know that we will be successful if we work together. So that's one area. Infectious disease, same. There are a lot of problems coming in front of us, and there's only one way is to join forces to be able to fight against that. So my learning is that first it's a confirmation that we are doing the right thing. We probably need to do more ambitious. I like Jo's comment that we probably need to think about high risk, to de-risking, not being worried about failure. But if we don't do it, it's not going to happen, or it's going to happen somewhere else. I think we are experiencing today a revolution, as you probably all heard. Artificial intelligence, machine learning, it's like common terms now that are being used. Big data. We are in the middle of a revolution. And if we look back in the history of the revolutions, US has been the country and the continent, usually the North America, who has been able to integrate those revolutions and take the best out of it. We have a chance to really leverage the maximum out of that. I was hearing the Avov with the investment, you know, that they're ready to invest. We have everything here to be successful. It's to work in partnership. We have the education system that is good. The healthcare system is solid. So for me, I'm very optimistic, but we need to be more ambitious and not being worried about risk failing. And my last point, and coming back to Wolfgang, I cannot resist after 10 years of experience in the IMI, we have learned how the process could be cumbersome in terms of lengths, in terms of administrative burdens, etc. We are working in a complex environment, so we should be realistic that we will not make something too simple. But I think we can gain by being more lean, by getting faster to decisions, accelerating. We have been able to run some programs like Ebola in an expedited way, 2 months to generate the funds and moving. Maybe we should look at that kind of models in the future, being faster, leaner, and then we become even more competitive.
And specifically on this point about cross-sectoral collaboration, because obviously there's a collaboration between industry and the various partners involved, but it's that specific thing about bringing in other sectors in artificial intelligence, in nanotechnology, and all those other areas that we discussed. Is that the future for IMI?
It is the present. And I'm speaking from the pharma industry, it's clear that this is not of our area of expertise. We are building up in this area of artificial intelligence, informatics, you know, and bioinformatics. We are partnering. So it's natural. IMI has started with the partners in research to enlarge the partners to non-pharma industries. And I think that's clearly the future. We need to have, and that's what you have heard today, multiple companies, not pharma industries, part of the ecosystem. They are part of the ecosystem, and they will be the critical partners for us in the future. So it's a no-brainer. So we have opened it, and we will continue in the next wave to continue to partner.
So I hope that's music to the ears of Khalil Rouhana, who's Deputy DG for Communications, Network, Content and Technology. In your view, to what extent should cross-sectoral collaboration shape the future of IMI? Bringing in some of these technologies, including many in your own space.
Yeah. Thank you very much, and sorry for being a bit late. Just to take the example of digital, I totally believe that innovation will come from cross-sectoral work and from mixing stakeholders from different communities. That's extremely important for the future. Extremely important today and has always been, a major factor for innovation. For the future of the health sector, digital brings in a wide range of opportunities for exploitation, as I could see in the questions raised today, in particular data and what we can do with data. But data is a whole value chain around data, so how to acquire data, so work in technologies like sensing, how to communicate data with all communication networks that we need to support, how to compute data with the work we done on advanced computing, high performance computing, and all the algorithms around data that we could use that today we cluster under artificial intelligence in particular, and how it could help us. So bringing all the actors across this value chain to work together with the health stakeholders, in general, is extremely important, I think, for the future. What we call digital transformation of areas of public interest is a major trend that will help us bring in additional services, better services to our citizens, and that would enable us to improve the cost efficiency of all our public sector. But the first example that comes in is the health sector, and altogether. So it is important. I believe a lot in partnerships, and I think IMI gives us an example of what partnerships could bring us as added value to bring the various stakeholders. I believe that partnerships that to be efficient will have to address research innovation, of course, but they could expand beyond research innovation, showing us the way how can Europe be a first mover in developing the best services and best health services for our citizens and the best healthcare for our citizens in the future. So partnerships, different stakeholders, the digital stakeholders are, I think, important for the future development of our health system and future partnerships. I hope they will integrate that dimension as well. We've been working a bit in silos so far, but I know that with Pierre and Bert, the management of the joint undertaking, we've tried to bring in the different stakeholders together and ensure some interaction at this stage. We could do more of that in the future, really. If I looked, we do look at the portfolio of research and development that we do in digital, which areas they would serve and which markets they're targeting. And the last analysis we've done show that more than 40% of what we do has direct impact on the health sector. Mm. So it's, and can help us improve our health system, be it in terms of equipment, so everything that goes from wearables to medical equipment to imaging, etc. On the equipment side, on the simulation modeling for the pharma industry and what we could do in terms of medicine. But more importantly, I think on the way we could transform the whole health system into more integrated care, from healthy lifestyle to prediction, to diagnosis, to treatment, to follow-up. And digital can be very important, and data is very important in that respect.
We've been talking a lot about data today, as you might imagine, and we've been talking about the need for data sharing, and that's very critical in areas like rare disease, across Europe. But we've also been talking about that there's fragmentation of data, that you're getting data sets which are, people kind of clutch to themselves, and how to tackle that. And we had an interesting suggestion from the EIB that maybe funding, investment funding, should be one of the levers that's used. Absolutely. To have, the sharing of data that's in an interoperable way. Do you see that also being something that IMI could help with?
Yeah, indeed. Very, very important. This interoperability of health data is extremely important, and the fragmentation data is a real issue. For health data to be usable for more personalized medicine, for tracking diseases, rare diseases or other diseases, it has to be anonymized, has to be aggregatable in an easy way. We have to be able to bring it to the scientists, to the practitioners in the easiest way, which is not the case today. We've been working, and we issued a communication on health data already earlier this year, and we'll be coming with a recommendation on interoperable electronic health records, on the standards for electronic health records, at least to start with this, an e-prescription, to make sure that ultimately we get into a similar way of describing the basic information for the health, for the health of our citizens in an interoperable way, so that we're able to integrate data across the union.
I mean,
But just to say that practitioners, what experts tell us and practitioners on the ground is that, yes, we can define a standard, and after a long time, we have now a patient summary standard, we have an e-prescription standard, but the problem is upgrading existing systems into a new standard, and that requires a lot of investments. To give you an idea, we did an estimate not only on the health system, but if we want to upgrade and adapt existing data that is held by the public sector, if we want to adapt it to normal standards, so to enable aggregation across Europe, not centralization, but to make algorithms run across different data sets that exist, that if we want to get up to 5% of the existing data sets that are in the member states to meta standards, in all areas, that just 5% would require close to €1 billion of investment. This is where we think that we can help at EU level. And what we propose under the Digital Europe program in particular is the creation of common data spaces. This is really deployment. IMI could help us because we need an agenda to see where this could be done, how this could be done. But we're proposing also to invest in the creation of these common data spaces, helping the adaptation of existing data to metadata standards to enable the aggregation of this. It's part of what we're proposing there, and we think it's amounts that are not negligible. We think that we can put 1 to 1.5 billion euros if what we propose in the future.
Well, you're seeing a very cheeky question there is, will DG Connect considering funding IMI 3?
Will DG Connect consider funding? Well, sir, we will be happy to contribute to the partnerships in health that are proposed for the future.
Okay. Wolfgang, you can see the question there. What will the future of IMI look like in Horizon Europe?
I suppose this question does not imply that there is necessary IMI, because it's about how does the future look like. Now, as you know, Horizon Europe puts considerable emphasis on health research. We have a whole cluster that is dealing with health research. And I think the issue is that we all together need to be able to prove that a public-private partnership is providing added value compared to what member states do, but also what we do on European level through our normal forms of funding through cooperative research. Added value in terms of scale, scope, impact. So it's not about business as usual, and I think the remark of Salah-Dine was quite pertinent. He said, well, I interpret his words like this: if you would like to have an institutionalized partnership, you need to be more ambitious than we are today, because you have seen that in Horizon Europe we have all kinds of partnerships, because we believe that for all the reasons that have been shared today, partnerships contribute to the excellence of research, but at the same time they ensure deployment of research. So we strongly believe in the concept of partnerships. But as I've indicated, for institutionalized partnerships, the criteria which we have laid down in Horizon Europe now as objective, you need really to prove that you are able, that we all together are able to prove that organized partnerships provide scale, scope, impact. That relates to the objectives which we want to address, to the stakeholders that we would like to involve. I think we have discussed here today already, we have the academia, we have business, we have associated partners, which are the medical devices and others. The question which we have discussed today, is it also about the downstream deployment stakeholders that should be involved? So that is a question, I think, which we need to address. And thirdly, institutionalized partnership is also about long-term financial commitment of the private partners in a public-private partnership. So I think these are the parameters which we need to be aware when we develop our ideas about the future of partnering in the health area.
Pierre, do you want to just say what you've taken away from today and finish us up?
Well, First of all, I'd just like to point out that the people from the Commission are walking the talk. So here we have 3 senior representatives of different DGs who have acknowledged that there's, the defragmentation issue is everywhere, and we need to collaborate much more. So there are very important building blocks that have been created and generated over the years, over the different framework programs, within these different Directorate-Generals, that they've sown the seeds for fantastic opportunities of synergies and collaboration. One is, of course, the interaction we have with Excel, our sister joint undertaking, where Khalil is the senior commission member. And there we have the head of programs, Patrick is sitting down there, of that joint undertaking here today. And we're discussing already with them, never mind about Horizon Europe, but what we can do today or tomorrow or next year. The next thing I think is that there has been, and Salah-Dine has described it very well, this acknowledgement within the pharmaceutical sector that they need other players in order for them themselves to succeed in their missions. And I think, as I said this morning, each of these components is a moving piece. And we need instances where we can ground these pieces on a platform and work together and co-create. I think the co-create word was already talked about, co-development of topics and so on and so forth, and this is what we need to do. The first objective of IMI 1, so the very first phase of IMI, was to be a public-private partnership in the area of innovative medicines. And why was that there? Because it was not at all obvious that we would be able to, that the pharmaceutical companies would be able to find some topics like safety, like Alzheimer's, like AMR, that they could actually work together on and share their data and build that community, mobilizing those industrial resources to work on things of social good. And I think that is an amazing feat that Europe, I think, can be proud of. So I think what I'm taking away from here is that we need to act, and as I said this morning, my job right now is to finish the implementation of the current program, and I have €1 billion to mobilize, half coming from the European Commission and half coming from the pharmaceutical industry and associated partners. And we have these opportunities with Excel and with other partners to, I think, even in the next 2 years, to do some magnificent things. And that's what I'll be leaving this thinking about how to do that.
Terrific. Thank you so much. And thank you all of you who've stayed to the very end. Very well done.
So, Vivian, if I can, I do want to thank you for moderating the day in a yeah, please take a bow. In a really, it was really fantastic day, and we're finishing pretty much bang on time. So thank you.
You can see we're only one who can balance the dominator of the men in this.
Thank everyone who stayed until the bitter end. We had a great turnout. We had 250 people coming to the sessions. We've just finished 3 days of a marathon IMI in terms of the science being produced. I think we've had probably 600 people dedicated to IMI over the last few days. So thank you all for coming. And of course, these events are challenging to get put together. And so I'd just like to have a shout out for my communications team and all the other people in IMI who've been involved in putting this together, but especially Iris, Nassima, and Catherine,
who have just done a stellar job. So a round of applause for them.
And that's the end. A cold beer awaits, I'm sure, somewhere.